Good afternoon and welcome to the second episode of In Conversation with Knights. We are here at the first Artus meeting in Rome with Professor Thierry Bosch, who has accepted our invitation for replying to 5 or 6 questions regarding the kingdom he belongs to in this Three Kingdoms challenge. Thank you, Professor, for being with us. First question is, what is the kingdom that you belong to, and do you identify exclusively with one kingdom or more?
Well, I've asked to be here as part of the kingdom of ultrasound, but as I told you, I also do quite some operative hysteroscopy, so I'm in between both, but my main focus is ultrasound.
Okay. And so, in ultrasound, what is the best weapon as a procedure or as a technique that you can have in your kingdom for the management of an infertile patient?
I think the advantage of ultrasound is that you have a broad view on different things, not only the uterus, of course it's about the uterus, but you also see the ovaries, the tubes, the deep endometriosis and so on. So you see it's for me the first step, because it's a first overview of what's happening in this patient.
Perfect, thank you. This is a third question. Considering the latest recommendations for the workup of the infertile patient, is there any update or modification that you would fight for?
Well, I think still the first test should be the ultrasound, as I told you, because you have the first overview, and then you can triage and see what additional tests or additional things you want to do. But I think as first test, I think ultrasound, after having say hello to the patient and ask what the problem is ultrasound. Perfect.
Thank you. Next question would be, what is your unpopular opinion in your kingdom regarding the infertile patient workup, if any?
Unpopular, a difficult question, but I think sometimes before doing some surgery, you have to think twice. I think I'm a surgeon myself, but I like to. Sometimes it's better to do nothing.
This is a very, very honest reply. Thank you. This was excellent. And then at the opposite, what is the most medieval practice ongoing in your kingdom during the workup of the infertile patient?
I think in the kingdom, in ultrasound, doing ultrasound with an old machine, not having color and not having 3D. I mean, that's medieval.
Thank you. Perfect. Last 2 questions. First would be, what among the other 2 kingdoms could be the ideal or the strongest partner for the final win, that is the reaching of the fertility outcome for the patient?
I think the part of this is hysteroscopist. I mean, I do both, and certainly doing a procedure under hysteroscopic procedure under ultrasound guidance. That's something we have to do more and more, and that's something that works.
This is the alliance. Last question that is a bit provocative. If you could duel with one knight, who would he or she be?
No, I'm a pacifist, so but I would perhaps I would duel with Sergio. I mean, I like him, so but more chatting than dueling.
Perfect. The challenge is set. Thank you, Professor. Thanks. Thank you very much.